All right, we're going to go ahead and get started. Good afternoon and welcome to today's Recovery Summit presented by St. Clair County Community Mental Health with support from the St. Clair County Health Department. Today's presentation is Advancing Recovery Across the Nation, presented by Donna Dimitrovic from SAMHSA. Before we begin, we just want to go over some general reminders. We know a lot of you have heard these already, but just in case anybody's new, please use the chat feature for all questions or comments. Our presenter will be answering questions as time allows. Today's presentation offers one social work CE and one MCBAP credit and one peer credit. If you are requesting professional credits, you must remain on the webinar the entire time for credit. If you lose connection, please reconnect as soon as you're able. A survey will pop up following the conclusion of the webinar. Those of you that are requesting social work CEs, a completion of the survey is necessary. And now I would like to introduce our presenter. Donna Dimitrovic is currently serving as the Senior Advisor in the Office of Recovery, Substance Abuse, and Mental Health Services Administration at U.S. Department of Health and Human Services. Donna supports recovery initiatives across the agency. In her previous role, she served as the director of the Center for Substance Abuse Prevention, where Donna provided executive leadership for federal efforts to improve the nation's behavioral health through evidence-based substance use prevention approaches. Ms. Dimitrovic is an experienced executive with over 35 years in substance use field. She has experience in raising public awareness and supporting program development and implementation for individuals with mental health and substance use conditions through advocacy, policy, and program development. Most importantly, Ms. Dimitrovic has lived experience of long-term recovery and is a family member of loved ones in recovery. This personal experience drives her passion to ensure opportunities exist to support others' path to wellness. Welcome, Donna.
Thank you so much. I really appreciate the opportunity to be here today to talk to you all about some of the initiatives that we have moving forward at SAMHSA. And I want to say that I, appreciate all the work that you guys do out in your communities, because at the end of the day, it really is, we can do this stuff at the national level, but it really is about what you do in your own community, helping folks on the ground. And we at SAMHSA are definitely your partners as you continue to do this work. And I, just want to say I really, truly appreciate it. Just a little bit about myself. I have been in the field for, about 35 years now. And as Christy mentioned, I am a woman in long-term recovery. So that really, when I got into recovery, I had all these opportunities that I had support to kind of get on my journey of recovery. And I continue to do this work, one, because I think people should have the same opportunities that I had in early recovery. But, more importantly, I'm a grandmother of 4, and I look at those grandkids and I'm like, I really want to make sure that they have the support as well, if they need it, as they get into their teenage and adolescent years. And so, this really has been a passion of mine since I've gotten into recovery. And I know you all, maybe you do, maybe you don't have that personal experience, but there, I'm sure there's someone that somewhere within your neighborhoods and communities that, actually help drive the passion that you have for the work that you're doing right now. So, I just wanted to start out to say Happy Recovery Month. And for those of you, I'm sure you all know that it is National Recovery Month, and that SAMHSA has been, behind the scenes kind of publicizing Recovery Month since 1989. It started out as National Alcohol and Drug Addiction Recovery Month, and then over the years realized that it really is about both substance use and mental health. And so that changed several years ago, where we SAMHSA acknowledged that this would be National Recovery Month. I think it was under Pam Hyde's leadership. And so, what we try to do during Recovery Month is really promote awareness of evidence-based treatment and recovery practices. And, I think those two go hand in hand. And so we, you know, the work that I do primarily is around peer support and peer services, but yet, it's also important for people to be able to get the treatment that they need if they so choose to get that treatment. When I got into recovery, my recovery process was through a 12-step. I didn't go to professional treatment, but that's not everyone's story. And so I think we have to make room for everything when we talk about the continuum of care, prevention, harm reduction, treatment, and recovery, as well as mental health promotion and support. And so, we really, as part of National Recovery Month, want to and have been collaborating with both public and private entities to celebrate people in recovery. And then, all of the work that we do here at SAMHSA, and some of you may know this, we had a walk for the first time in, I think, about 10 years, a walk for recovery in Washington, where we went from Union Station to the nation's capital to really highlight recovery. And that was at the beginning of the month. And, we want to make sure that folks know that there's a strong and proud recovery community out there. We know that there's dedicated service providers and community members that support recovery. And that means in all forms across the country. So, we talk a lot about many pathways to recovery. And, we certainly do honor that here at SAMHSA. So I just wanted to highlight, some information that we have gathered over this past year here at SAMHSA. I'm sure you guys are familiar with NSDA, which is our national survey that we do. Well, in 2021, there were questions that in the national survey, which was random sampling across the country, that really looked at folks that identified as being in recovery. And so of that study sample, there was 71.7% of individuals that considered themselves to be in recovery or have recovered from a substance use or mental health condition. The data also showed that 72% identified as being in recovery from substance use, while 67% considered themselves as in recovery from a mental health condition. We at the Office of Recovery released a report on September 20th. It was live streamed. I'm not sure if y'all had a chance to see it, but it has more detailed data. So we kind of broke down the data according to demographics, men versus women, age, community. So as you can see on this slide, recovery was more often reported among non-Hispanic white adults than any other race or ethnicity. As we move forward, gathering this data, certainly, our hope is that we will be able to include more questions within the NSDA so that we can get concrete evidence, I guess is the right way to say it, concrete evidence of the fact that people can and do recover. This is just a copy of the recovery research report that we put out there. It is available on our website. And if you're interested, if you go to our SAMHSA website, just look under news releases and you'll be able to see, I think it's the second topic there that will show a link to this recovery from substance use and mental health problems among adults in the United States. When we had the presentation last week, there was, we had, I don't know if this is good or bad, but, we commented that it has taken like 15 years for us to be able to get this done, but we have kind of persevered and got this done and been able to have these questions here within, the NSDA data. And, for SAMHSA, for us, we know anecdotally a lot of the things that are happening, but we don't have a lot of research across the country that's focused just on recovery. And we understand and acknowledge that there's more work to be done. And we certainly want to continue that conversation so that we can support the work that's being done by folks across the country. So I just wanted to talk a little bit about our national recovery agenda, the aim and purpose. And, a little bit of history around the Office of Recovery. The Assistant Secretary, Dr. Delphin Rittman, announced back in 2021 that the agency was really committed to recovery and supported recovery for all Americans from substance use, mental health, and co-occurring disorders. And so we made the announcement there would be an Office of Recovery. And what we did was in August of 2022, we brought together stakeholders from all across the country for our very first recovery summit that was not only substance use, but also mental health. Historically, when SAMHSA held any recovery summits and looked at, bringing together stakeholders and partners, it was either or. So it was either mental health or it was substance use, but it was never both of us coming together to kind of collaborate and work together on putting together an agenda for SAMHSA's Office of Recovery. And, the conversations really that we gathered through that, it was a 2-day event. We were able to put together an executive report. Of course, this is also available on our website to anybody that's interested. But we were able to gather our strategy together for the Office of Recovery. And really our overarching goal and purpose for the office is to pursue recovery, build resilience, and achieve wellness for individuals, families, and communities all across the country. And these were the 5 goals that were identified as a result of all of those conversations. It really is what drives the work within the Office of Recovery. Inclusion, equity, peer services, social determinants, and wellness. And I'll go into each one of these a little bit so you have a better understanding of what we're doing within the Office of Recovery around these 5 goals, but also kind of like what drives the work that we do. And so our goal number 1 is inclusion, and it really is nothing about us without us. And what does that mean? It really means that we want to foster the meaningful involvement of a wide group of people with lived experience to improve behavioral health practice and policy, and to foster the social inclusion of people with behavioral health conditions. Here at SAMHSA, we recognize and value the voice of individuals affected by substance use and mental health conditions. Within the Office of Recovery, all of our staff identify as either being in recovery or a family member or a loved one of someone in recovery. So we all have that lived experience and bring that perspective. A lot of us also worked in communities, doing the same type of work that you're doing over the course of our careers. So we bring that skill set as well. The other thing that, we have identified within SAMHSA is that, we needed to look at not only the work that we're doing in the office and the work that you guys are doing out in the community, but we needed to really think about putting together a policy around inclusion so that all of the centers and the offices within SAMHSA include the people, the voices of people with behavioral health conditions in policy and program planning. And, we worked on that with our leadership, I think I forgot to mention this, but one of our guiding principles at SAMHSA is around recovery. And so really the Assistant Secretary has determined that recovery should kind of lay the groundwork for all the work that we're doing. And so, when we put together the inclusion, we felt like, it was important if we're asking others to do that out in communities, we also needed to do that at the federal level. Our second goal is really focused around equity and recovery for all. So our hope here in the Office of Recovery is to be able to increase opportunities for recovery for underserved and under-resourced populations and communities, which includes people of color, youth, older adults, LGBTQI+, rural, veterans, and people with disabilities. And, I know for me, at one time I worked in Nevada, which is a really rural and frontier state. And I'm sure you all have rural communities in Michigan. And, we want to make sure that folks also have the same opportunity to get the services and supports they need to gain recovery. And you know, I know we have a huge focus within our Office of Behavioral Health Equity at SAMHSA. We're looking at how do we best serve the under-resourced and underserved communities, because they're out there. I was in Arkansas last week, and I had a speaking engagement, and I was going through towns where the population was like 126 people. And as I was driving through there, I thought, what happens if somebody if something somebody needs some help? Where do they go? How do they access those services? So that is kind of always on the forefront of our mind. Along with recovery, equity is also a guiding principle of SAMHSA. And so we have a new strategic plan that really focuses on equity and realizing the opportunity for anyone and everyone if they choose recovery. The president also, in his Recovery Month proclamation, included accessibility for everyone to the services and supports in order to rebuild lives of purpose and hope. So it just shows that the administration also is really focused on equity for folks. And over the last couple of months, I said our office is fairly new. We just had hired our staff last year. We announced the office in August of 2021. We staffed up the office in September of 2022. And so over the last year, we've been really, really busy getting things together and trying to listen to our stakeholders and partners and federal partners all across the country. And one of the things that we did around equity was to host our Tribal Recovery Summit. And it was the first time in SAMHSA history that we hosted this Tribal Recovery Summit, and it brought together over 200 individuals in Dallas, where we focused on issues relevant to the peer workforce, providing recovery support services within tribes and territories. So that was kind of a historic thing. And then, again, our hope is after hosting these meetings this year, we'll have a follow-up where we got recommendations and ideas from folks that attended, and then we'll move forward to the next step of where we move forward with policy and programming. Our third goal is really around peer services, and the value of peers, helping peers, can't be denied. Our hope is that we can expand peer provided services within every community. SAMHSA has long been committed to peer and recovery support services for over 20 years and really continues that commitment forward. Some of the ways in which we are working to expand peer provided services is to, you can see by some of the grant funded programs that we have. For instance, the Peer Recovery Center of Excellence is a TA center, a technical assistance center that SAMHSA funds that helps provide technical assistance to new and emerging organizations across the country that are providing peer services, not only community-based and recovery community organizations, but as well as like hospitals and other institutions that are interested in having peer services provided within their facility. We also recently had three meetings around the peer workforce. So in particular, we had a large peer workforce meeting that was held in the Washington, DC area to really focus on and hear from folks of what's happening right now out in the field. But we also had a couple of meetings in our regions, SAMHSA regions, to really focus around peer support and to hear what's happening. Because I think the other thing too, while we do this work on a federal level and nationally, we also understand that every area is different. I originally started my work in Pennsylvania. The Northeast in Pennsylvania was like far ahead of some communities. And when I, went out to Nevada, realized that it was a lot different there than it was in Pennsylvania. Like, while I had learned a lot in Pennsylvania, it was like a whole new learning curve, being in a different community. And I think that's all part of the process. And, we don't have to reinvent the wheel, but certainly we can, understand the differences or the nuances for each community that we may be serving. And along with these peer workforce meetings that we hosted by the Office of Recovery, we also published the National Model Standards for Peer Certification. And this is just a copy, which this is available on our website. What we did was we were tasked by the President's Unity Agenda to come together and bring stakeholders and other federal partners together to really look at how we could provide guidance, promote quality, and encourage alignment and reciprocity across peer support certifications across the country. Understanding that each state has their own peer certification process. So, we brought together a technical expert panel that really looked at some of these hard questions, but based on what the task was under the President's Unity Agenda, we really listened to what we were hearing and developed these 11 standards that are put into a report that really our hope is may help states and communities to look at ways in which reciprocity might be a little bit easier for people. I know when I was working in one particular state, it was very hard for somebody to come into my state that had gotten certified in another state because it wasn't easily transferable, that certification process. So how do we make that easier for folks? And our hope is that these model standards might be able to provide some of that. The other thing I just wanted to mention is that SAMHSA years ago released the core competencies for peer workers in behavioral health services, and those core competencies really are this national model standards are really built on those core competencies so that these documents can go hand in hand. So I would encourage you, or any of you that have not seen these documents, to check out the SAMHSA website because we do have a wealth of information that may be able to help as you start or continue to do your work in communities. Our fourth goal is social determinants of recovery, and it really is about addressing whole health care. So we talk about social determinants that support recovery, and that includes access to housing, education, social supports, and employment. I think about, when I think about SAMHSA's definition of recovery, we have, we also identified 4 dimensions of recovery, which was home, health, purpose, and community. And they really do, I think, coincide with some of these social determinants, because, it's not just about, treating the mental health or the substance use. It's, looking at a person holistically, what else may be happening that is a deterrent for them to be able to find recovery. I know for me, in early recovery, finding a job is really important, being self-sufficient, being able to find a house or a home, an apartment to live in, all of those things had to take place. And I think, that kind of support, as I talked about when I started my talk, those supports were crucial, and I mean crucial, for me to be successful on this recovery journey. And I think, thinking about all of this is really important. And, when you think about somebody's recovery, and developing a wellness plan, while we don't have the answers for all of these issues, certainly being able to identify and make those connections can also be helpful for people. I think, recovery housing is really important. Supported housing is very important. I've been learning a whole lot around supportive housing. I have my background is really in substance use, but I live in Florida, and I've been working with the Florida Supportive Housing Authority, and learning a lot about how that supports people that need to get not only that need a home, but also folks that need those supports all the way around. And I think being mindful of all that, and learning about what is available within your communities certainly is helpful. We recently put together our best practices for recovery housing. This is specific to substance use recovery housing, but our hope is that this report, which describes 11 standards and provides kind of like an overarching framework for evidence-based recovery housing, will help any recovery houses that are operating to kind of look at these standards when they're designing their programs, or say they're engaging in policy development. When you think about it, the goal is really to provide a safe place for people to live, and have that kind of overarching theme of recovery within the framework, and then being able to have folks have an enhanced quality of life. I think originally, when the very first recovery housing report was put out in 2018, it was focused a lot on ethical practices, because there was, there had been a few lawsuits that had been out and about around, folks in recovery kind of being co-opted, maybe that's not the right word, but that, taken advantage of, and not necessarily being put in a place that was really ethical and had standards. So that, and then the other piece of that very first report kind of focused on treatment as well. But this report is really looking at that social model, and having folks, individuals that are in the recovery house, have the ability to access community supports and recovery support services within their own community. I do say that, treatment is great, and it is a really important part for folks, a lot of individuals' recovery journey. But if they're in a residential program and they go out into the community, that's where the rubber hits the road. So what do we have to support people once they get out in the community? And I think recovery houses are really one of those ways in which we can help, to support people. So let's see. This is our best practices for recovery housing. Again, and I'm talking a lot about these reports that we have, but as this was National Recovery Month, we had a lot of products come out at SAMHSA, and we announced the best practices for recovery housing at the Oxford House convention, which was at the beginning of September. Our peer national standards were announced about a month and a half ago. And then we also had the recovery research report, which was announced last week. So, we've been pretty busy in the Office of Recovery trying to get all this information out, and hopefully it's really helpful to all of you that are working in the field. And then number 5, our last goal is really around wellness. And it's to expand holistic self-care strategies to improve health and behavioral health outcomes, including the reduction of early mortality and the impact of comorbid chronic health conditions, and to integrate recovery-oriented practices and systemic reform into the full continuum of health and behavioral health care, including prevention, harm reduction, treatment, crisis care, and recovery support. And we really, our hope is that we can assist individuals to return to a state of wellness, practicing really healthy habits instead of just surviving. Our hope in the Office of Recovery is that we want people to thrive. And we believe that everyone can recover. And through our efforts. And I don't mean just at SAMHSA, but I mean all of us that work in this field across the country within the continuum of health and behavioral health. We really do believe that this is achievable. And then the last thing I just wanted to talk about was is the policy changes that represent new opportunities here at SAMHSA. You know, these are some of the things that have happened over the course of the last year. And I just wanted to highlight some of this, you know, for those of you that don't know, SAMHSA just updated our strategic plan. We put it out there for public comment. And we really do recognize that equity and recovery are core principles of our work. The president's executive order on DEIA really focuses on the administration's commitment to equity across all agencies in the federal government. And I did mention that a little bit earlier. We were able to make the recommendation to Congress and the president that we changed the name to our substance use block grant. It used to be the Substance Abuse Prevention Treatment Block Grant. It's now changed the name to the Substance Use Prevention Treatment and Recovery Support Block Grant. We believe that, you know, if we're asking people to be mindful of their language, you know, not to use stigmatizing and discriminatory terms, that, you know, it really is important for us as well to kind of lead by example. We also, as I said, we established the SAMHSA's Office of Recovery, and now through the block grant, the Substance Use Prevention, Treatment, and Recovery Support Block Grant, there is a requirement for states to be able to fund recovery support services. More to come on all of that. I know there is some work being done within our agency, you know, to describe what recovery support services can be funded. And hopefully that will make it a lot easier for states and communities as they continue to do that work. So, you know, moving forward within the Office of Recovery, I just want to say that, you know, every year we put in the president's budget a 10% set aside within the substance use block grant, specifically for recovery support services, as we have both for prevention. You know, that has yet to pass, but, you know, we continue to push that forward. You know, one of the things that we'll be doing in year number 2 at the Office of Recovery, and we just recently had our staff strategic planning session to look at like what we have done over the past year, as well as what we plan on doing as we move forward. And, you know, we, for those of you that are familiar, the recovery-oriented systems of care work that SAMHSA did many years ago, a lot of information is available on our website. We're going to begin to review that and to make sure that it's both inclusive of mental health and substance use. You know, as I said earlier, there was a lot of, you know, kind of silos, and the Assistant Secretary really wants to bridge that, you know, recognizing that there are differences. But, you know, as we look at recovery, the recovery process, you know, really being able to, you know, think about how we can transform the system so that folks that, you know, want support and want help and, you know, are in or seeking recovery can kind of get that wherever they need it. And as well as and I also want to mention be person-centered so that folks can, you know, identify what they need and determine, you know, how to move forward in the recovery process. You know, so we'll be continuing some of our regional meetings, recovery meetings with the regions and the regional directors across the country, looking at, you know, what's happening within the communities out there. And then we also are going to be reviewing all of our peer and recovery support materials that SAMHSA has available on our website, because we want to make sure that best practices and evidence-based practices that really have been learned over the past probably decade are now available to anybody that wants them, because we know the information is out there. We just need to compile it and put it together. So we've been talking about ways in which we might be able to do that. The other thing that we do within the Office of Recovery, just so is that as things come out of SAMHSA, out of our centers and other offices, we're always asked to review to make sure that it has a recovery orientation. The materials that we're providing has a recovery orientation, and the voice and kind of like the eyes of people with lived experience, because it is really important to have folks, that are, impacted by the work that we do, to really be able to give us feedback, honest feedback, criticism. Certainly, we want to hear from all of you in ways that we might be able to actually support the work that you're doing, one, but also be able to hear from you on what's working, what's not. And then, we know that there's lots of innovation happening out there too. Sometimes we get caught up in doing what we had been doing, for years and years. And, it's great to be able to hear about some work that's new and innovative and helping, folks, and, being able to highlight that is something that we certainly appreciate within the Office of Recovery. So this is just SAMHSA's vision. This is our new vision, and envisions that people with, affected by, or at risk for mental health and substance use conditions receive care, achieve well-being, and thrive. And if you need more information, certainly any grant opportunities are listed on our SAMHSA website. I know 988, we have, a whole website and information on that. Please take advantage of the materials that we have. Certainly, you can reach me. My email is donna.dimitrovic@samhsa.hhs.gov. And I'd love to hear about the work that you're doing. So with that, I'll close, and I appreciate your time today, and I'll take any questions if you have any.
We still do have some time. Could you tell us more about what is coming, what SAMHSA has coming, like in the near future, like programs or anything to do with the recovery?
Well, so the Office of Recovery, we don't oversee any programs or services. We're kind of like the policy wonk around recovery throughout SAMHSA. But I do know that just recently we were able to award a lot of grants. The Building Communities of Recovery grant, which is out of CSAT, the Recovery Community Support Program grant, which is both community and statewide based. There are also there's been a lot of money around mental health and recovery, and a lot of those grants also, they don't require, but they recommend that peer support is a part of not only the application process, but also part of the services process. So, we try to make sure that we infuse all of that within any of our grant applications or grant awards. If people are interested in that, on the website, it will list all of that. I'm sure there's some people that are on the call that have a SAMHSA grant that may be doing some of this work. Our CCBHCs are thriving throughout the country. So, I can't actually speak because I'm not the expert on all those grant programs, but being able to have the voice of recovery within some of those the applications and the funding announcements is really important to us here at SAMHSA.
right.
Any other questions or comments or?
We haven't had a lot of questions pop up, just a lot of people are saying thank you so much. That's a lot of
Oh.
great information and they appreciate the information. I do actually have a question. It says, will grants be affected by the possible government shutdown?
Well, fingers crossed, there's not going to be one, number one. I would say I would recommend that you talk to your grants manager if you have a federal grant to find out. So get ahead of the curve because I don't know. I mean, I know if, we're just keeping our fingers crossed that it doesn't happen. But definitely get in touch with your project manager, your grants manager, or your project officer and get guidance from them.
All right. Thank you so much for all the information today, Donna. We really
Oh, you're welcome.
appreciate it. Just as a reminder, this is our last week of the Recovery Summit. We still have a few more topics each day. If you're interested in signing up for those, go to our website at sccmh.org under events. And then it'll be under Recovery Summit, and then you can see all the information for the upcoming events. Also, if you're requesting any professional credits, you'll receive your certificate of accumulated credits by the end of October. There will be a survey that pops up at the end of this presentation. Please remember to complete that survey. We appreciate all your feedback, as does the presenter, so that they can know what what information you'd be interested in hearing more about. Thank you again to our presenter, Donna Dimitrovic. Your time and information is very appreciated. And thank you all who attended this morning. You have a great day.
Thanks, everybody. Thank you. Bye-bye.